I'm really excited to see all of the implementations at work within the school districts. They sound absolutely fantastic. So I'm going to go ahead and try to change my slide. Here we go. So thank you, Texas Tech University, for actually asking me to come back. I so enjoyed presenting at that conference. And I know I did have to rush through the last couple of slides I had for that conference. So I'm hoping that we have enough time today. So I want to welcome everybody. This presentation is going to be about El Paso's youth, substance use, and other emerging data. And if at any time there is a question, please put it in the chat. I can't see the chat, but if anyone is kind enough to let me know that there's a question, if I can answer it, we will do that.
Yes, and I'll be watching the chat and the question and answer module so that and so either if there's a point at which I can ask, I'll bust in there, but mostly I just wait until the end. But please put all your questions in. If it's something medical, then I might just answer myself. But I'll make sure to, if it's a question I think that the whole audience would really benefit from, then I'll make sure to read it out and the answer that I sent out at the end. Okay, thank you.
Great, thank you. So today's goals or our objectives are to compare data from 2019 and 2020 regarding El Paso's adolescents, to report on newly acquired data, and to discuss what these data sets mean and how we can use them in our various fields. Okay, so first let's talk about population. For the purposes of this presentation, we're looking at adolescents. The World Health Organization, or the WHO, defines adolescents as persons in childhood through teenage years ending at age 18. El Paso's youth population is steadily increasing. Those don't look like huge numbers, but they are increasing. In 2019, there were 258,762 persons aged 0 to 18. In 2020, we went up to 259,356. And according to the Texas Demographic Center, who does a population projections estimate for us, in 2021, we will more than likely have about 259,625 adolescents 0 to 18. So before we begin to dive into some of this data, I really want to emphasize how COVID is going to kind of be like this big elephant in the room when we talk about data, especially in terms of 2020. So let's start with alcohol-related data first. According to the National Survey on Drug Use and Health that came out in 2019, 414,000 adolescents aged 12 to 17 were experiencing alcohol use disorder. 163,000 of them were males and 251,000 of them were females. So how does this data translate to the borderline? So as mentioned before, the data pulled today is only regarding El Paso County, to include Fabin, Socorro, San Rosario, Anthony, and so on. In 2019, for the county, we had certain violations recorded for DWI, drunkenness, and liquor law violations. So very briefly, I'm sure some of us might know, but for those of us who don't, I'd like to go over what constitutes drunkenness and a liquor law violation. So when we talk about drunkenness, we're going to consider that to be public intoxication. And it is usually charged when someone is intoxicated in a public space and poses a danger to others or themselves. When it comes to liquor law violations, that can be things like being underage and in possession of liquor or alcohol, if someone buys past the hours of allowed sales, an open container in the car. Keep in mind that the keys cannot be in the ignition, the car cannot be running, or over serving a patron who happens to be a minor. Now, in those last cases where you buy past the hours of allowed sales or you are over serving a patron who is a minor, the person is actually charged and so is the facility. So let's say 7-Eleven sold a 16-year-old beer at 4 in the morning, then they would be charged as well as 7-Eleven. Okay. So in 2019, we had 239 DWI arrests, 21 arrests for drunkenness, and 169 arrests for liquor law violations. And this is aged 10 to 18. In 2020, DWI was still the most prevalent charge for adolescents, as we had 97 DWIs, 11 charges of drunkenness, and 42 charges of liquor law violation. Okay. And of course, COVID-19 since it caused so much of our world to come to just a glaring halt, some of those social situations that would normally have occurred, or vigilance that would have taken place, such as in our schools, were put to a stop with the shutdowns. And what I mean by that is last year we actually didn't have very many graduation parties, for example, because we were shut down and told to isolate and social distance and all those other things. Okay, but so how does 2019 compare to 2020? Drastic drops in areas might look promising, but as stated, COVID-19 could have had a direct impact on these drops. So I want us to be careful when we're thinking that these numbers are, really promising and positive. I want us to just, kind of err on the side of caution here. What will be interesting to see is the impact the reopening of Texas has on these numbers for 2021, as we were still relatively halted for the first half of this year. So if we move on to drug-related data, Texas agencies label this as minor in possession, or MIP. I'm sorry, I went backwards. There we go. In 2019, we had 1,579 arrests for possession of illicit substances. And this is substances anywhere from marijuana to crack to LSD to bath salts to methamphetamines, amphetamines. But in 2020, there were only 456 arrests. There's no doubt that the shutdown affected what we have caught and what we didn't catch. And as a matter of fact, in 2019, EPISD police accounted for 167 of those 1,579 arrests for minors in possession. But with EPISD being closed down during the pandemic, in 2020, they only accounted for 37 of the 456 arrests for minors in possession. But how's 2021 looking so far? In the county, there have been a total of 69 arrests for minors in possession from January 2021 through mid-June is when I got those numbers. EPISD police have had 0 arrests so far, as UTEP has as well. And the bulk of these arrests actually have come from EPPD. And normally what we see is that EPPD does have most of the DWI arrests, DUI arrests, as well as minor in possession. So where else do we look for an idea of what our youth are into, participating in, or areas where we can help them? Our very own Texas Education Agency, of course, or TEA, if you're more familiar with that. So every year we pull the discipline rates for Region 19. And this year I went ahead and pulled 2018 to 2019 and the 2019 to 2020 school years. Right away, we can see huge differences. So this is the suspension and expulsion data for Region 19. We have 2018 and 19 in orange and the 2019-2020 school year in green. The 2020-2021 school year is not available yet. I don't imagine that that'll be available until sometime in the fall. Otherwise, I would have these numbers available as well. The thing that we saw the most issue with was controlled substance violations. So this could be things like marijuana, THC would be more of a felony controlled substance. And so we see that in 2018 to 2019 school year, we had 799 suspensions and expulsions for that violation. In 2019-2020, we had 678. Now keep in mind, I know that this sounds like, wow, that's kind of a lot though. This is all the school districts in El Paso County, right? So Socorro, San Elizario, Isleta, El Paso, Fabens, Anthony, even some of the charter schools like Harmony that we kind of lumped together here. So let's break it down by school district. We're going to start with El Paso Independent School District just because it's the largest one in our county. They did account, so 2019-2020 is going to be in the orange this time, and I'll have the green for 2018-2019. We can see that there was a vast drop in some of the offenses, and it looks great, but there were no students on campus for us to monitor and for us to catch in anything. So some of these did occur off campus. But again, the numbers that we see the most violations for are going to be controlled substances and felony controlled substances. When we look at a school district like Clint, they're a little bit on the smaller side and they're still having an issue with controlled substance. We can see across the board Alcohol violations, 0. Felony controlled substance, 0. Tobacco, 0. Title V felony, which I put in there only because of an emerging issue. And I'd like to come back to that once we hit that emerging issue. Same with Gunwithio Independent School District. The controlled substances in 2018 to the 2019 school year, they had 67 violations of that, but none across the board otherwise. And this year was relatively quiet for them as well. Ysleta is another large school district for us, and they had quite a bit of suspensions and expulsions for these violations. They did have more tobacco and controlled substance than they did alcohol, but that is not to say that alcohol is not a pressing issue in the borderland. Socorro ISD, another well-known school district, they actually had more of an issue with the alcohol violations and controlled substances than some of the other school districts had. And that's important to look at when we consider like our 2019 DWI numbers and our drunkenness and liquor law violations. So how did the other districts fare? So some of them had really nothing listed, and I didn't feel like making a graph would be important for them. So in 2018 to 2019, Anthony ISD had 0 violations. Harmony Science Academy had 23 tobacco violations. San Elizario had 45 controlled substance violations and 13 tobacco violations, while Tornillo ISD had 16 alcohol violations. In 2019 to 2020, Anthony had 0 violations. Harmony had 0 violations. San Elizario kept up the numbers in the same categories, 34 controlled, 12 felony, and Tornillo ISD had 60 alcohol violations. So where else could we gather data about what our kids are doing? And maybe not exactly what they're being caught doing, but what they're willing to admit that they're doing. So the Texas Education Agency compiles discipline data for violations that are actually observed, but the Texas School Survey, or TSS, asks students to voluntarily answer questions regarding alcohol, tobacco, and other illicit substances, their use of those, and frequency. So before we get started on the TSS, I want to read to you the disclaimer that they actually put out for the 2020 TSS that was released just a few months ago. And it states, during the 2019-2020 school year, schools across Texas were closed from early March through the end of the school year due to the COVID-19 pandemic. Due to this sudden and unexpected closure, many schools that had registered for the survey were unable to complete it. Please note that both of the drop in participation, along with the fact that those that did complete did so before March, may have impacted the data. This is a really important disclaimer, as Texas is divided into 11 regions, and we are in part of Region 10, which, as I stated before, is El Paso, Hudspeth, Culberson, Jeff Davis, Brewster, and Presidio counties, and that the TSS is solely reflected on Region 10 schools' participation. Because of the drop in participation numbers this year, Region 10 was put together with Region 9. So when we look at the TSS data, 2019 and 2020 is Regions 9 and 10, and 2018 is Region 10 by itself, okay? Now, before we jump into some of the things that the TSS asks, let me give you an idea of the numbers they were working with for these surveys. I don't have a chart for this, I apologize. But for the 2018 survey, there were 60,776 surveys submitted. For the 2020 survey, there were 27,965 surveys submitted. So that's a difference of over 30,000. Okay, so let's keep that in mind as we're looking at our numbers here. So the first question we're going to look at is, how recently have you used tobacco products? Now, the TSS divides this into 4 categories for them: any tobacco product, cigarettes, smokeless tobacco to be things like dip and chaw or chew, and e-vaping products, okay, electronic vape products. So these are all percentages that we're looking at here. So we see that in 2018, which is the dark orange color, and 2020, which is the lighter melon pink color, it went up from 2018 to 2020, right? We had 15.4% of students say that they had used any tobacco product, and that went up to 16.9. What we see as the highest number, however, is going to be the e-vape products. We see that it went from 10.3 in 2018 to 11.6 in 2020. And that becomes very important as we move further along. So the 2018 alcohol stats are also really important. These are broken down into very easy to obtain. Easy, where do you get it? Easy to get at parties, and have you used alcohol in the past month? So in 2018, we see that 32.1% of students said they had used alcohol in the past month. 10.8% of those students said that it was easy to get at parties. 21.5% of students stated it was very easy to obtain alcohol. And if we look at the 2020 numbers, they're not much better, unfortunately. 31.6% of students stated they had used alcohol in the past month. 7% said they had gotten it at parties, and 22% stated alcohol was very easy to obtain. And if we look at the last three TSS surveys from 2016, 18, and 20, we would see that the alcohol stats are relatively static. The TSS also asked students in each grade level from 7 to 12 how old they were the first time they had alcohol. And we can see that in most grades, the age of initiation is getting lower, or rather, the kids are getting younger. So if you look at grade 7, in 2018, they stated they were about 10 years old the first time they had alcohol. And that didn't change in 2020. They're still 10 years old. Grade 8, also that grade is getting younger from 11. So 11.5 would be like 11 years old in 5 months. They went from 11 and 5 months to 11 and 3 months. And it's like this across the board, just ages are dropping, okay, from 7 to 12. But in addition to asking about alcohol and tobacco, they also ask about illicit substances. And what kind of substances does the TSS ask about? Well, they ask about marijuana, cocaine, crack, hallucinogens, synthetic cathinones, which are bath salts, steroids, ecstasy, heroin, methamphetamine, and synthetic marijuana. So when asked if they've used any of these substances in the past month, we can see that the highest category is marijuana, which is a good thing, right? When we consider how damaging some of the harder drugs can be. Not to say that marijuana is not harmful, but some of these other drugs are much more dangerous, much more quickly. So I wanted to point out that in 2020, that number did drop a little bit, but we're not sure how accurate this is because we had such low participation. And remember that this is a cumulative percentage of 7th through 12th graders surveyed. Okay. This now brings us to some of the emerging issues in the borderland. Following the fact that the TSS has reported that marijuana is the most used illicit substance by students in grades 7 to 12, the first issue we come to is that of THC use amongst our adolescents. So I hope you guys have a reaction feature? If not, you guys can just put it in the chat. How many of you know that if you are caught with THC in any form, right, a wax, scatter, in your vape, that it is an automatic felony when you are on school grounds or off school grounds? Yeah, you know what, as a parent, I had no clue either. So this is really important information, and I'm glad that so many of you are willing to open up and tell me that you didn't know, because I mean, who knew? If the student is caught with THC in any form, as I stated, it's a felony, on or off campus, okay? So this graph right here breaks down our THC charges over the last 3 years. Now, in 2018, we only had 8 felony THC charges, and this is the color, the graph in orange. On the other hand, we had 371 charges of possession. So when we look at possession versus the felony charge, let me explain that a little bit. A possession charge is simply marijuana, normally in its natural form, its natural state, right? So the flower of the marijuana, and it's under 2 ounces, okay? Now, The minute we take THC and we mix it with a vape, we mix it with other narcotics, that makes it a narcotic, and it is therefore judged as a felony possession. And this is what a lot of kids aren't knowledgeable about, as well as the parents in El Paso County, is that if our children are using a vape that has THC, they will be charged with a felony charge here. So, and it can be very serious. It can lead to things like expulsion. It can lead to things like jail time, probation, referral to the juvenile justice department. There are a lot of consequences to deal with. So if we look at that bar in orange, we see that it has steadily risen over the last 3 years. Now, the data I have for 2020 is current as of November of last year. Then there were 169 felony THC charges. And remember, this can happen on campus or off campus. So unfortunately, we know that the vaping industry is targeting the adolescent community, and that those advertisements, along with products that are designed to conceal vapes like backpacks, watches, hats, make use of them so much easier because they're able to hide in plain sight. So if we look at the breakdown of just 2020, there were a total of 239 offenses. 169 of them were for felony offenses and 70 were for possession of 2 ounces. Okay. Now, the second issue is youth drug trafficking. And we remember that graph I had where it said Title V felony. So a Title V felony is things like criminal homicide, kidnapping, unlawful restraint, sexual offenses, and so on and so forth. If you think back in your mind over the last 6 months to a year, you might remember some cases on the news where teens had been engaged in shootings with each other, and normally the underlying issue was that of something to do with drugs, right? Something to do with drugs, narcotics, something about that. Well, unfortunately, what we've been noticing here in the borderland, and I've sat through some trainings done by Ms. Emily Dawson that she has been facilitating, is drug trafficking. So a brief overview of that shows that between March 1st, 2021 and June 15th, 2021, there were 27 cases referred to the Juvenile Justice Department for youth drug trafficking. This is compared to 12 cases in the same time frame in 2020. The majority of cases involved importation of hard drugs, such as heroin, fentanyl, methamphetamine, and cocaine. Of course, with the legalization of marijuana in several states, the demand for harder drugs has been higher, and this might be a reason we see things coming in now. So who's targeted and how? Mostly US citizens with family living in Mexico. Statistically, they've seen adolescents between the ages of 13 and 17, both males and females, although the percentage of males is higher. They have been targeted mostly through social media like Facebook, Snapchat, Instagram. And this is what makes it so much harder for us to find is social media. It can be deleted. Social media, our kids feel is super private to them. And so conversations with our kids about these are going to be vital. So what are the consequences of trafficking in drugs? All the current bridge cases are being labeled as super aggravated or first-degree felonies. And the punishment for that can be anywhere from 0 to 40 years in prison. I'm just going to take a minute for that to sink in. So some of these kids who are 13, 14 years old are looking at some really hard time. And what Ms. Dawson brought to light was that in addition to the youth drug trafficking numbers kind of going up, what we're also seeing is that these narcotics are not leaving the borderland as they were before. They're actually staying in the borderland. And the reason for that is it's getting harder to kind of push drugs through the normal channels, if you will. And so they're staying here to be sold, which is why when we think about some of the altercations that have arisen with our adolescents in El Paso, some of them do center on drugs. Oh, wow, that was all really heavy, right? But it can't be all that bad, right? And no, it isn't. It can't, and it isn't. So, really beautiful flowers. I just love mine. I wish we got more of it. But nevertheless, let's look at the TSS again. In addition to asking how often students have used substances, they also ask if you've never used those substances. And here's what they've said. So how many have never used tobacco products? Well, those numbers are actually pretty promising. We've got the 2018 survey in orange and the 2020 survey in green, and we can see that those numbers stay pretty steady. They don't really drop too much, and that's a really positive number to know that, man, 70% of kids have never used an e-vape product. 66.3% of kids have never used tobacco at all. 92% have never used smokeless tobacco. Those are really promising numbers. Likewise, how many have never used alcohol? Well, any alcohol product, 46.6% in 2020, and that's actually up from 2018. Then we have wine coolers, right? 69.4% in 2020 who have never used it versus 66.5% in 2018. Wine has also gone up. Never used, 67.9%. And liquor has gone up as well to 64.1% from 62.7% in 2018. How many have never used illicit substances? Any illicit drug, we're looking at 75.2% in 2020 saying they've never used it. And let's look at that marijuana number. 77.5% of students surveyed in 2020 said they have never used marijuana. And that's up 5%. That's up 5% from 2018. So that's really promising. That means that the education we're doing in our communities and the conversations we're having as pediatricians and teachers and counselors and law enforcement and you know, any one parent, aunt, uncle, sister, brother, it's working, right? So how do we assist adolescents in our community? And this is where I want to hear from some of our attendees today. How do we, in your various professions, things within your control, how do we assist the adolescents in our community? You can drop it in the chat. I'm going to open up the chat box right now, or you guys can unmute yourself and let me know. I do apologize about the fuzziness in the audio. I think my laptop is dying. Not like the battery or anything. Just okay, great. So we have someone say they refer to Aliviane, and I'm going to tie that in just a little bit. Okay, great. Provide more resources and support for them to feel safe talking about these issues. That's really important. Screen during psychiatry appointments, right? We need to ask and suspect it. Okay. Yes, know where your kids are and who they're with. Very important, right? Like that age-old at the end of the news, it's 10 p.m. Do you know where your children are? I probably dated myself with that, but I remember that commercial. That's what we need to do now. Okay, great. So now that we've heard from some of the attendees, and please feel free to keep putting those in the chat, I'd like to point out that there are community resources available and tell you what some of those community resources are. So first we have Aliviane, right? Aliviane has 2 locations, but one is a women and children's shelter, and that is located on North Loop. The other one is located at 1626 Medical Center Drive. We do have services there from a methadone clinic to intervention and prevention, as well as homeless shelters and homeless shelter programs. Okay, so let's go over a couple of the resources we have at Aliviane. So first we have Prides, which is it provides youth sessions, typically in a school setting for youth of all ages. Group sessions focus on teaching youth social, drug resistance, and personal self-management skills. And if you are interested in anything, I also added the contact name and extension numbers. We have the next program, which is Strengthening Families. This is a community-based program that provides family sessions for families with children, focusing on teaching families coping skills, setting boundaries, and communicating with one another. Then we have I'm a Star. which provides youth sessions typically in a school or community-based setting. They focus on teaching youth about positive self-concept, positive actions for body and mind, managing yourself responsibly, and treating others the way you would like to be treated. We then have the El Paso Advocates for Prevention Coalition, which is a partnership that encourages community mobilization to address substance use and misuse. They work towards changing local policies and influencing social norms related to substance use, to include underage alcohol use, tobacco and nicotine products, marijuana and other cannabinoids, and prescription drug misuse. Then we have the PRC, which is what I'm linked with. They are the Prevention Resource Center for Region 10. They increase the capacity of the statewide substance use disorders prevention system. We seek to enhance community collaboration, increase community awareness and readiness, and provide data and resources on substance use. So if there's ever any data that you need, I would be the one you contact. And lastly, we have the Padre program, which is the Parenting Awareness and Drug Risk Education Program that provides community-based intervention services to parenting males and females at risk for involvement or currently involved with the Department of Family and Protective Services with substance use disorders or who are at risk of developing substance use disorders. Additionally, I'd like to invite you all to attend an Advocates for Prevention Coalition meeting. The contact for that would be Sean Semko. He is our CCP coordinator. His phone number is listed here with his extension and his email. The next APC meeting will be July 15th, 2021, and they run from about 9 to 10:30 in the morning. There are 4 work groups that we divide up into, and it is the show, which is social host ordinance, where we discuss ways that we can really get the message out there to parents who may be hosting parties, unwittingly providing alcohol to people and not realize the social host ordinance is in place. Hold is a place of last drink work group. We are trying to get bars to be held more accountable for over serving. And so when people are stopped for DWIs or DUIs, we are trying to get police officers and sheriff's department to ask where they were last served so that we can make sure that we target some of these areas for more education. Then we have the RX disposal group, which deals with throwing away unused or dangerous medications or expired medications that we may have sitting around so that they don't fall into young hands. And then lastly, the THC and tobacco group, which focuses on THC and tobacco education for our youth and parents. I posted up some links, and I'll be allowing Joyce to send out the slides to anyone who's interested so that you have these links. We have Smoke-Free Paso del Norte. Some of you may be familiar with that. Here, they have a lot of educational resources and links to articles and such. And also Healthy Paso del Norte as well. Additional community resources. Someone mentioned screening your patients during psychiatry appointments and such. You can also refer them to Emergence Health Network. They have a great OSAR program, and they can help with screening and such, whether it's substance use disorders or mental health. We also have the Stephen A. Cohen Military Family Clinic, which is Endeavors. I felt it was important to make sure that we included the military resources that we have, as we are a large military community. Endeavors also has programs for homeless veterans where they provide housing free of charge for, I believe it's a year, and they also help them with job placement. Okay, and so this is the phone number to contact them. Well, we have El Paso Mental Health. We have the Isleta del Sur Pueblo ASAP program. We have Homeward Bound. Of course, the El Paso VA healthcare system. I gave 2 numbers, one for mental health, and then the other one is for the substance use disorders hotline. And of course, our El Paso behavioral health system. So I know that was a bunch of resources, and look at that, Dr. Martin. I actually got through my presentation this time without having to rush through it. So here is my contact information. If anyone should need any data or you want a further presentation, I also do presentations for parents on THC and how our kids are hiding it. And please follow us on our socials. We have an Instagram, a Twitter, and a Facebook. And this is strictly for PRC. If you want to follow Aliviana, you can always follow us and then find them. And now I'd like to open it up to any questions.
All right, great presentation. Thank you so much. Okay, so first thing, I know everyone's going to ask us after this presentation if they can have your slides, especially because you put the whole resource section so they can, save that and be able to refer their patients to the appropriate organization. So do we have your permission to send the slides out to the audience today?
Absolutely.
Okay, great.
Yes.
Great. And then what else do we have for questions? I know that's always the number one question. It looked to me, so I've been involved in a task force because of the whole felony problem with the THC. And I don't know. It seems like it's slowing down because like some years when it first started to get really popular, it was like, 175% of the amount of felonies as a previous year or the usage, just huge increases from year to year. Do you think it's kind of stabilized out, or is it the reason that we aren't having big increases this year? It's just because you don't get as high of a felony or you don't get caught as often if school is not out, and it's a lot of the high school kids, of course, are home this whole year. What do you think?
I'd love to be optimistic. Unfortunately, I'm a realist, and I'm gonna say I don't think that it's. I don't want to say it's stabilized. I don't want to say it's improving, but I do want to say that I think the numbers just for 2020 were still fairly high. And that's even with kids not being in school. You know what I mean? So that's just getting caught off campus. And I can't imagine if we had been in session face to face, what those numbers would have looked like. Definitely. So I'm going to err on the side of caution and, hope that when school does start back up August 2nd, as we know, there's no more virtual. So everyone has to attend face to face. We'll really see what that year off did for everybody, whether it heightened it or lowered.
Yeah, it's going to be really interesting. It's going to be really interesting to see how things change when we get out of 2021, and then also after 2022, 2023. As all the doom and gloomers are definitely predicting a big increase in everything horrible having to do with mental health, but. Yeah. I don't know. Kids are very resilient at the same time. So, but another thing that we can do for practices like as Texas Tech, but then also as our network is if anyone needs handouts in their offices, let us know and we'll contact whoever we need to in order to get you all information to give to your patients and to give your patients' parents. Just let us know about that.
And of course, we also have RX disposal bags, which are called doTERRA bags. So if there are any facilities that are interested in obtaining some, you can always email Sean Semko. Let me go ahead and put his contact information in the chat again. He actually is the CCP coordinator and he has all of those doTERRA bags. So if anyone is interested in handing them out to patients or just having them around your own facilities, to dispose of medication, please feel free to reach out and contact me.
And how does that work? What happens with the medications or when you put them into
you place the medication in the bag and it's got like a solution in there and it helps dissolve it. So that way you're not like, flushing it or putting it down the drain or throwing it into the trash can, but you're disposing of them safely.
Okay. So after it dissolves, then you can put it in the trash can?
Yes.
Is that how it works? Oh, okay. So there's no process other. Oh, that is good. That is good. Oh, Dr. Covarrubias wants some info. We will definitely do that. Thank you. Send you some info for your patients to have in your clinic. Oh, one thing else I wanted to talk about, and I know that Joyce will help me by sending everyone an email with the information, but I just want to tell you about, as a community, we have started a story time once a month. And it's run by one of our CPAN staff, Bethany Shrewsbury, together with Eloisa Pleaders Escobar. and they read stories that are about mental health issues. It is meant for an elementary school kids. They're storybooks. So we read the whole story. And then Bethany, who's an LPC, discusses afterward the themes and how parents can talk to their kids like that. So we'll send you all that, and hopefully we'll send you flyers that you can post in your offices in case your patients want to log on. So it's this month, I think. What's the story this month, Joyce? Tell us about the story. Oh, she has it in the chat. I Am Jazz. What's I Am Jazz about? I forgot.
So it is about a real life gender identity experience for children. And Bethany will be talking about that. Oh, there, she put it in the chat as well.
On the 30th, we will be discussing transgender children. There we go. Okay.
At 11.
Yeah, so first they read the story, and then they have a discussion. The kids can ask questions. Oops, my chair's slipping. The kids can ask questions, but also Bethany gives tips for the parents as well, so they can talk to their kids. So anyone, it's really, they do such a great job with this. We haven't gotten as many people signed up for that as we would love to have, because we'd love to have hundreds of kids, but it's going to be at 11 a.m. on the 30th, June 30th. And it's a Zoom link just like this that parents can easily log on to from their phone or their computer, so their kids can hear the story. And eventually we're hoping to go to the local libraries and do the same thing. So if anyone has any library contacts, they can let us know. Also, we have in the chat, if you look in the chat, there's the survey that also is linked to getting your credit for this presentation. So if y'all can fill in the survey, that'd be great. And one of the most important parts of the survey is that it has a space where you can put what you want to hear about in the future. And Joyce and I and Adrian and Bethany, we're all planning our next year of presentation. So make sure you have your voice heard and tell us what is going on in your practices that you would like to learn more about. And all our staff are vaccinated. And so we would love to come visit you all in person. And so anyone that would like a visit in person, and we have lots of resources that are, physical resources. One of our most popular is our medication cards. It's like little cards that you put onto your hospital badge or your clinic badge. That it's like a cheat sheet for psych meds. And so we'd love to come and meet with you all. Oh, there it is. She has them. And so they're very compact. And so I need to do a little bit of explanation on how to use them and all. But yeah, you have them right there. So then when you find a kid in your clinic that's depressed, and you just whip it out and you look at what age the kid is. It's done by age and starting dose, but also how fast you can titrate it. So it's just a little cheat sheet. So yeah, let us know if you'd like us to visit in person, and we can bring all our educational materials. Let's see, we have. Oh, and I think Bethany put the link in the chat, but she only sent it to the panelists. Bethany, if you can send it to not just panelists, but the attendees, then the audience can see your Zoom invitation for the story time.
Yeah, I put it on there too. I can put it again.
Okay, great.
Oh, there she goes. She's really quick.
Technologically savvy. But thank you all for coming. And also remember, I don't know if everyone caught it, but at the beginning, before we started, I talked a little bit about our school program. So we also have a school program where students can get 5 sessions of either therapy or medication or both, depending on their needs. And the school districts that have signed up so far are Socorro, Anthony, Canutillo, San Felipe del Rio, Buena Vista, San Elizario, Clint, Fort Hancock, Tornillo, Faven, Sierra Blanca. So most of the El Paso County districts have signed up. And this is a way that all you have to do is ask your patient who needs a psychiatric evaluation or a short course of psychotherapy. You ask the parent to contact the school counselor, and then the school counselor will send the referral to us, and it's a telemedicine program. So we coordinate with the school getting kids treatment right away, and we can get the kids in really pretty fast because we only do 5 sessions with each child or adolescent. The counties I listed are just the ones that have signed up with the Texas Tech El Paso hub of the Texas Child Mental Health Care Consortium. So if you are in another region of Texas, all you have to do is call the closest medical school, and they will tell you if your district is signed up, if your local school district is signed up. And so there's many all around Texas. Also, another way to check to see if your patients are in a school district that offers this is to look on the Texas Child Mental Health Care Consortium's website, and they have, you put in your zip code, I believe, and then it'll tell you that if the school district in that zip code has joined TChat again. And then I know a lot of people on these presentations that have joined these presentations are very active in their community and are also on school boards or have a lot of work that they do with schools. And so if you work with a school district who's not signed up yet, you might want to encourage them to sign up. Not everyone has signed up yet, but we do have capacity to sign up all the districts that are asking us right now. So maybe eventually we'll fill up, but then we'll just go back to the drawing board in terms of our budgets and reorganize the budget so we can hire more people. So this is not only through CPAN, the Child Psychiatry Access Network, can you call us up and we can help you with your patients over the phone, but now we have this pretty well-developed program called TChat that goes through the schools. So give us a call if you wanted any more information about anything. And I see Dr. Covarrubias wants more info. So yes, I'll give you a call. I'll send you my number and we can talk some more. Thank you so much, everybody. We have so much information to share, and we try to do it in 1 hour chunks so we don't take up too much time, and it'll fit with the CME so everyone gets their credit for their licenses. But we really appreciate you all signing in. Here's a slide that has all the counties. And this is the number that you can call to talk to us. We also have a local phone number. It's, what's our local phone number? 915-215-4021. If you want to talk to our staff here or me, I'm here most of the time. So thanks so much, and we will talk to you soon.